Active lengthening techniques are another highly effective method for treating the posterior compartment muscles, which can be challenging to access with certain treatments. I'm going to begin this technique by having my client slide down towards this end of the table and get into a side-lying position. You want the client to be positioned so that their foot can be off the end of the table enough to be able to perform full dorsiflexion and plantar flexion without hitting the table. Since we're focusing the deep posterior compartment muscles, they're going to be lengthened during dorsiflexion and shortened during plantar flexion. So the stripping technique will be applied during the dorsiflexion and pause during the plantar flexion. So here, let's keep that going. Kim, just keep this going right about this pace right here. Good. And you can do this with one thumb, for example. Strip, pause, strip, pause, strip. Working up the whole length of those deep posterior compartment muscle attachments on the back side of the tibia, getting up into the soleus in the upper portion. We could also do this with two thumbs if you wanted. Strip, pause, strip. Just like that. And just relax for a moment. Let's suppose we have an area that we want to focus a little bit more attention on right in this one specific area. We could go and cover that several times. Again, keep that going. And strip, pause, strip, pause, strip, pause. Just right on that one specific area, encouraging lengthening and elasticity in those tissues. And suppose we wanted to increase this a little bit more because we're not quite getting penetration down into those deepest fibers. We can add additional resistance to that. I can simply push on the bottom of her foot and say, Kim, hold this here and don't let me move it. And now slowly let that go. As she slowly lets that go, we're getting an eccentric activation in those deep posterior compartment muscles. So here's what that'll look like with the treatment. Hold this here and slowly let it go. Good. So the active engagement techniques can be done with a couple different variations, but they're very effective in addressing the chronic tension, tightness that happens in those deep posterior compartment muscles.